Hello, folks. Welcome yet again to the show Legends of Medicine. A man who has firmly etched his name in Indian medical history and world's history. Here's Dr. K.M. Cherian, a world-renowned, distinguished cardiothoracic surgeon who is a pride of India and has been conferred with the civilian honor of Padma Shri in 1991 by the Government of India. Welcome to the show, Dr. K.M. Cherian. Sir.
Thank you.
Cherian is a pioneer in cardiac surgery, he has an illustrious career over decades. I can keep telling you the first, but let me name a few of the first at least. Dr. Cherian has performed the first successful coronary artery bypass graft surgery in 1975, the first heart transplant in a private hospital, Madras Medical Mission, Chennai, after the legislation of brain death was put into place in India in 1995. He did the first heart-lung transplant, the first pediatric transplant, the first laser heart surgery TMR, and he is the one who was instrumental in bringing in the legislation defining brain death in India in Lok Sabha, Rajya Sabha, and getting it converted into a law. Currently, Sir is more than preoccupied and busy with his own foundation, K.M. Cherian Heart Foundation, and Frontier Lifeline Hospital, where he is the chairman and the CEO. You're also the chief and the head of cardiac surgery there, actively practicing and actively doing research as well. Sir, welcome to the show. It's absolutely my pride and the pride of the country. A legend. Nonetheless, you are a legend, sir, for us. May I ask you a question to begin with? Sir, I went through a biographical account of yours, which has been penned down about you, your many firsts in your long illustrious career, and also about your humble beginnings, your struggle right from those early days in Kerala. And to the audience, I must share that this biography is called The Hand of God. How do you feel, sir, when you are celebrated as the gifted child of God with the hand of God? How do you feel, sir?
I feel happy naturally, but the most important thing is this. To become happy or contented, you should have done something to help others. There are many ways of making money. There are a lot of people who are very rich, but not many had the opportunity to have, say, about 46,000 operations, open heart operations done. And I had the interest of operating mainly kids. The reason is this. When people ask, why do you do that? I always tell them, the reason is simple. That is, when I grow old, one of my patients may be the Prime Minister of India, who knows? So, future is in nobody's hands. But we are just acting as sort of a fulcrum, so to say, or you are symbiotic for their growth. And the other aspect is this. It gives me a lot of thrill. People ask about robotic surgery.
Right.
If robot operates, what is your thrill? If robot makes a mistake, who takes the responsibility? So that responsibility, self-responsibility and the thrill. What is thrill as far as surgery is concerned? It is perception. That is where the thrill comes. You being a, obstetric gynecologist, specialized in IVF, you know
Yes,
it.
sir. Yes, sir.
So if somebody gets pregnant because of all your, technology, etc., you are happy about it. The same way, after birth, if the child has been too sick to survive or may not see the first birthday, if you are able to give not one birthday, many birthdays. My birthday was on 8th. I had so many emails, so many, the photos being sent to me saying that, this is the photo which was taken when I was 6 months old or 3 months old. Today I am this. In fact, one of the wild photographer, a girl, she had sent me one photograph of her when she was 2 months old. Now how she is.
No, it's absolutely a pleasure. It's absolutely a pleasure to see them grow.
That is what is the pleasure and reward. Because I feel I am one of the luckiest fellows who has got this, this award. That is getting the opportunity to help others. Now, as the Emperor Alexander the Great said, when he was being taken for, the body was being taken, not body before death. was being taken to the burial ground, the major or the generals asked, "What can we do for you?" At last he said, "Get diamonds, sapphire, whatever expensive stones, gold, silver, everything. Lay that road to my burial ground, and my coffin should have two openings on either side. Keep my hands out." So they didn't understand. Said, "Let the world see that I conquered the whole world. See, here I am going with the empty hand."
Empty hands. True, true.
So that is a moral. That is what if you can leave behind a legacy. There is nothing like that. When you are alive, if your professional colleagues hold you in high regards and reverence, then that is the achievement. That is getting recognition from your own colleagues in your own field.
True.
That is also very important. So that has been my philosophy.
Dr. Cherian, I think not just the legacy which you have given to the people, not just the philanthropy, not just the intent, not just the hard work, but it is a matter of pride for us Indians that you are one amongst the only Indian to have been selected with the unique honor of having your name inscribed in stone in the island of Kos in Greece. And I must tell this to our audience that this place is the actual birthplace of Hippocrates, the father of medicine. And if in that city, on a stone, Dr. Cherian's name is inscribed, of course it was done during the recent World Congress which was conducted by the World Society of Cardiothoracic Surgeons. But sir, it's the legacy which speaks volumes for itself in your lifetime itself. An absolute salute to you, sir, for this.
Thank you. Thank you.
Sir, there goes this story which is actually an impactful event which happened in your life, wherein there is this trauma of the first heart operation that you had seen in your life, and the first time you donated blood, and the very first death that you saw on the operation table. Can you share what really changed for you that day?
What really changed me too?
What really changed inside of you that day when all this happened?
Well, I do not know. I always had interest in at least looking at the heart of lizards or, mice or whatever it is. I used to have some thrill out of it, to be honest. And also, see, you have to be at the right place with the right people at the right time. That I believe. Because I went to US or Australia and all. There were people to help me in US. At least my brother helped me monetarily to start. I went to Australia with $6 in my pocket without knowing anybody. Somebody else helped. So wherever possible, if you get an opportunity and realize that it is an opportunity, then you should grab it. But at the same time, it is associated with lot of risk. That is what people don't understand. But nothing will come without work. You have to work hard. There is a lot of risk involved, and you might succeed, you might not succeed. But in my case, God has been kind enough that I got all what I wanted. So that is something rare.
So you started your career in Christian Medical College in Vellore as a surgery lecturer. You went on to move to Sydney in Australia, and you completed your fellowship in the Royal Australian College of Surgeons. Then you moved on to New Zealand, you moved on to United States. You imbibed a lot, you learned a lot. Life really took a full circle for you and you came back to India.
A lot of people have asked me the same question. First thing is this. I knew I have learned whatever I could. And also I knew that there are a lot of pitfalls. So the best thing is how to find out your deficiencies. You try it on your own. So I wanted to come back to India and see whether I can reproduce whatever I have learned.
True.
And that is the first thing. If it was for the sake of money, I would have stayed back. But I didn't bother because I knew that there is a fortune here. And then after I did the first bypass, then only I knew that this is a first bypass. So I could do the first pediatric cases, so many other things. So a lot of people told me, you will go back, you will be a failure in India. In India, nothing works. Lot of red tapeism, etc., bureaucracy, everything, political, interference, everything. Anyway, nothing happened to me. and I could do all these things. That is the most important thing. That is, I could do all these things what I wanted. But then, once I established that I am one of the pioneers in this field, in this country, why should I go back to anywhere?
It's true.
If I had
So
gone to Australia or US, where I would have been? I would have been nowhere.
You worked as a fellow in pediatric cardiac surgery in Birmingham under Dr. John Kirkland, and of course with Dr. Albert Starr in the University of Oregon. Dr. Christian Bernard has also contributed in your life, and so have people been impactful from Boston Children's Hospital, from surgeons from Harvard. What is it, sir, that you imbibe and you take home when you work with people of such league?
No, I think, my philosophy is different. I try to pick up whatever is best. You might have some good points. You might have some good points. But whatever it is, I try to put all these things together and get a good honey syrup out of it. And that I practice. So it is not imbibing something from one, but from probably the best at that time. As I told you, the best time and the best place. The best time is this. All the pioneers in cardiac surgery, starting from Dr. Lillehei, whether Albert Starr or Denton Cooley or everybody has been known to me. From my background, I think it is a great achievement because I was nothing. We are from an agricultural family and I am the first doctor.
Right. You shared with me that you come from an agricultural family in Kerala and that there is no one who is a doctor in your family.
Yeah.
And you're the first one to do that. And now that, how do you reminisce those good old days of Kerala as a child?
Kerala as a child, see, we run a school, probably the best school in Pondicherry.
Lekol International?
Right.
In Puducherry?
Yeah.
The study?
Yes, that we run that school. So I always used to think my olden days, that is, I studied in my mother's birthplace. That was a government school. That time, the government, that is the Travancore government, it is not the Union government of India, Travancore, not even Kerala. So every 6 months, because of the rain, heavy rain, the roof will come off. What is the roof made up of? Coconut leaves. So half the time we will be in the sun, half the time we will be in the rain. So the best place to have a constant shelter is a mango tree. Fortunately, we had plenty of mango trees in the backyard of the school. So the class 1 will be this mango tree, class 2 will be the other mango tree. So I studied under a mango tree. When we started the school and when I applied for land to the government, they showed a couple of places, but I was just looking around. Then I saw one place with a huge mango tree. I said, this is the land we need.
Yeah.
So we had 13 students to start with. We did not have a building. The building was our mango tree. Then I saw one place with a huge mango tree. Today we have 2,460 students. Now that is one side. The other side is this. My grandmother became a widow at the age of 24. My mother was 4 years old. So my mother has not seen the father. And this old lady, she was looking after this child. That means she was almost like a single mother. So the preference for admission and the scholarship and support is given by me only for single mothers, girls, children. The reason is...
Single mothers who have a girl child?
Yes.
Okay.
The reason is, I feel that if you, help a child, rather a girl to study, it is equal to supporting 10 boys. She will be much more influential and she will do much better. To tell you an example.
Girl child is a nurturer to the family.
Yes.
She's the feeder to the family.
Yes.
She is the homemaker. She is also a better financial manager.
Yes, and I'll tell you a simple thing. 1997, we had a tsunami in Pondicherry.
Mm-hmm. Yeah.
A young man was washed off. He was hardly 28 or 29. And his wife was 23. She had 2 children, one 3.5-year-old child and the other was 1.5 or 2-year-old child. So I decided that I will help this because I thought of my grandmother and my mother. I thought I will help them. I gave this lady as an aide in our kindergarten, where that time we had about 50 students. So she doesn't have to go and help other fisherwomen in their cooking and get meager income. So
Life's journeys does bring in life lessons, sir, and you also have a charitable trust which you have built called Saint Gregorius Cardiovascular Center at Parumala in Kerala.
No. That is different. This school is looking after, and that girl, that 3.5-year-old girl, her name is Devika. I encourage her whichever way possible, because every birthday I will give her a present.
Okay.
And she appeared for the 10th, and surprisingly, Devika stood first in the state of Pondicherry.
Marvelous.
And I asked her, what do you want to become? Her answer, it really amazed me. She said, I want to become a gynecologist. So I said, who taught you this word? Then she said, my auntie died of cancer uterus. Our women, they are very shy. They will not tell anything about their health.
Right.
So she wants to become a doctor. So I said, don't you know about the NEET exam? She said, yes. So you have to learn. She said, I am learning. After we have dinner at home, I will go to the next street. There is a net cave and I'll spend 1 hour there. Then come back and see. I said, you have passed your 10th. You're a big girl now. You should not be walking around in the night and all. I will help you. So that time, I was going to Singapore. So when I came back with a laptop and gave it to her.
How nice. How nice.
Now,
How nice.
it's not only that. That is the time when this app came, Dragon Voice. 5 languages you can learn, conversational languages.
Mm-hmm.
So I made sure that she will have an app for Dragon Voice also.
Okay.
And the net result is that today she speaks 5 languages. And she passed her NEET and she got MBBS admission and she is doing first year now.
How nice. That's so nice. So nice. I was asking you, sir, about your endeavor which you have done in Parumala in Kerala, St. Gregorius Cardiovascular Center.
Yes, that is, we used to conduct a camp on my mother's death anniversary day. And it was getting little difficult because we had a mobile diagnostic bus and the number of patients started increasing. That time, the bishop there said, why don't you conduct this, your free camp here? So that is how we started doing a camp. And then later on, we took a portion of that mission hospital on rent and we started cardiovascular surgery. And this is the first hospital in a remote village in a panchayat to have tertiary care cardiac surgery, which many of the metropolitan hospital has not done. Something like homografts, Ross procedure, infant surgery, etc., etc. So much so, in the end, Dr. Abdul Kalam was so keen to see this.
Mm-hmm.
So he came and visited. And the next Republic Day speech from the Red Fort, he mentioned about Parimala, saying that every Indian villager should be like Parimala.
Yeah, true. In fact, Dr. Kalam has always been so fond of children. So when he wrote in his book called Ignited Minds, he said that he had once been to a school and how much he loved children and he used to go to schools. So there was one school he went to and one of the child raised his hand and said that, sir, but you have to tell me who is the first scientist in this world. So this child asked Dr. Kalam that you are a scientist, but who was the first scientist in this world? So Dr. Kalam answered, he said, every child born is the first scientist in this world because a child is inquisitive, non-hesitant, ask questions, and such was his love for children. And I'm sure it comes to pediatric cardiac surgery, he would have certainly had a very special place for children and the challenges that such children face. So yes. You have been at the President House and you have been the honorary surgeon to the President of India. How does it feel to treat the President of India?
I have never treated him. The reason is this, he was very healthy.
That's good. Prevention is better than cure. You have to have the right person by your side to feel good.
Yes,
absolutely.
This is, it's an honor to say that you are the surgeon to the President of India. Yes, it is an honor. But luckily for me, he was all right. He didn't have any problem at that time.
Good, good. You are now, sir, the founder chairman of Frontier Lifeline Hospital and also at Frontier Mediville, which is the first medical SEZ and medical science park in India. What was your inspiration to start this? And how do you think you are a differentiator in this field now?
Yes. Just one reason is this. I had the opportunity to work with two innovators. One is Albert Starr, who invented the first artificial heart valve. The second is the man who perfected and made open heart surgery safe. That is John Kirkland. I had also some association with Dr. Lillahi. He started open heart surgery using what you call cross circulation. And I also had the opportunity to work with Sir Brian Barrett Boyce, who was also part of the reason why profound hypothermia and circulatory arrest was started. So I had that, the spirit that you must also do something. And India was the virgin land. There was nothing here. So whatever I did, nothing great, no innovation, nothing. But because I did it for the first time, I became an innovator. Otherwise, as such, I am not an innovator or anything. But
That's
I have
very humble for you to say that.
No. I have the interest. So stem cells we started. In fact, we are the first unit in the whole of Asia to start stem cell, and we had the the largest series in Asia when we presented it in Paris for the PCR conference in 2019.
You are doing this research, aren't you, sir, wherein you are looking at the shark fin, and from there you are trying to develop pancreas, liver, heart, and if that would mean that if we can develop through that, then we can put that and we don't need to have immunosuppressants and such challenges?
Yes, in fact, I read somewhere that a time will come you can have your spare parts in the backyard. So we know that shark skin could act as a biological scaffold. What you need is a bioreactor, which we don't have. But we are working with IIT Madras and CLRI, Central Leather Research Laboratory. Now we know that these living parts, like whether it is shark fin or shark skin, all these things could be used, but especially shark fin. Now, if you want to do a transplant, you have to get so many permissions. If it is a foreign patient, NATO, there are so many. Now, there are so many units doing heart transplant now. But I can tell you, I can take one credit. That is, I was responsible for getting this brain death legalized in India. And that was through the help from Dr. Srinivasan, who happened to be the health secretary, Union Government. He only motivated me. Mm-hmm. That is how we called for a big meeting. And in Chennai, in South, East Calcutta, and West Bombay, lastly in Delhi. Then only it went to the upper house and the lower house, and it was legalized. It is not that, people will think that transplant is a very, complex operation. It is a straightforward operation. Any man who can, you being a doctor, any man who can cut should be able to suture also.
The suture also.
That's all. That is our transplant. The rest is teamwork.
What they call in computer language, sir, copy and paste.
Yes.
Cut and suture.
Yes. Why other people, senior people could not do, that is because they could not form a team. They have forgotten the fact that cardiac surgery especially is a big teamwork. If you don't have a cardiologist, can you do this? No. If you don't have a good anesthetist or an intensivist, can you do this? You need a good perfusionist. Like that, if you go, everybody has to work harmoniously, and it is a big teamwork. So making a team is the most difficult.
All 5 fingers make a fist and they work together. And I being in the field of IVF, again, sir, it's all about teamwork. You have to have all the right people, right from embryologists to clinical specialists, counselors, everybody in place. So without a team, it doesn't work.
Same way, for us also, you need a counselor, grief counselor.
Yeah,
you need a coordinator. All these are important. See, when you do an infant transplant or a retransplant, every time it gives you more and more interest, because one girl when I think she was 24 or 25, she was a Karnataka state hockey player. She developed cardiomyopathy. Mm-hmm. She needed a transplant. I did a transplant for her about 8 years ago. Mm-hmm. She did very, very well in the sense she went for Paralympics and she was representing India after the transplant. Then 3 months later, she was readmitted and in front of the hospital, she arrested.
Oh.
After coming from Spain.
From Paralympics.
So we had to put her on a ventilator, IABP, ECMO, all waiting for a recipient. Waiting for a donor.
For a donor.
We kept her on ECMO, IABP, all sorts of things for 4 days and then we got a donor and we retransplanted. Now she's in States, 3 years after retransplant. So that gives you thrill. And especially when I came to know that she did a paragliding in Dubai, 13,600 feet. Even normal people will be scared to jump.
Not just scared, look at the height, look at the oxygenation, look at the challenge.
And also, she has done an underwater walk in sea.
So she's challenging the heart and she's challenging the retransplant to her good and making us feel so happy about our functioning heart.
She's a big motivator.
You also mentioned to me about this heart failure baby which was barely 6 months old and you had put the stem cells. Could you share that journey with us?
See, this girl from Bombay, I think she was 4 months old, not 6.
Okay.
So we used stem cells. Again, how can you get enough stem cells, say at 50 cc from a 4-month-old in severe failure, just skin and bone. So we matched the father's bone marrow and used the stem cells for this girl. And at the age of 6, she went to the school, started going to the school. She was very active. And when she was in 11th grade, she became the captain of her school cricket team. So, these are all possible. And, even now, we are the only people using cardiomyocytes for heart failure in this country. You can say such and such hospital is there. All the hospitals are only glass. So, what is important is, your motivation, your hard work, and your expectation of nothing from them except that you are giving them life.
Yeah, because this is not just converting a challenge into an opportunity. It's not just a story. It's not just a tale. It's about having faith in your own self, delivering the treatment, and also finding it inspirational at the end of it when you see positive outcomes. And your patients also have challenged their own health and shown credible outcomes to you to set it right from the girl in that school who's now doing medicine to this girl who is the head of the sports captain to the girl who went into Paralympics. They have challenged their own health and made the impossible possible with your outcomes and treatment.
Now I'll tell you one thing. When a lot of people ask me, are you not taking risk? That is just the ordinary ideas. To me, the patient and the patient's relatives are the one who's taking more risk than me, knowing very well that this guy is doing for the first time.
Yeah.
So who takes the risk? Patient and the relatives. I admire them, not me.
True, when it comes to counseling and consent and you tell them that this is experimental therapy and the outcomes are yet not known, but as they say, you've given a series of firsts, and the first does not come without enough research and courage and science and knowledge, for sure, sir. I would dwell a little into your hobbies and passions. I'm told that you have a wonderful collection of guns.
I had.
And you used to enjoy hunting in those good old days?
Yes, I had. Very recently only I got rid of all those because I had almost 7 guns, different types of rifles and champagne loading, Webley and Scott and this and all those things. So now there is no point. The reason is this. There is nobody else who is interested in it. My son, I gave one to him. He lost even the license. So you need some interest.
True. And what about the research that when you were talking about the prosthetic valves, the biological prosthetic valves and the short life of 7-8 years, and your current research that rather than using pericardium, if you could use goat skin and create valves through that, what is that pioneering research that you are doing, sir?
See, apart from using decellularized goat skin. The other area where we are looking at is shark skin. For an example, a shark at 100 feet depth, when it swims, it is usually 90 kilometers per hour. So that means so much of pressure the skin can withstand. One. As far as my knowledge goes, shark skin doesn't get calcified as early as like bovine pericardium or any pericardium. So you have to have a lot of anti-calcification treatment, etc. Everything is, poison. Any chemical is poison. So if you have something which doesn't get calcified, withstand any pressure, I think it is a good substitute. Now, you know that nobody eats a shark skin. They peel and throw it off. So that is why I said this is wealth from waste or waste to wealth. What is being thrown on the beach, if you can make bioprosthetic wall out of that, it is different. The same way. You need a lot of cooperation. Say, for example, NAL, National Aeronautic Limited in Bangalore. They are the only people who can make nitinol. Yes, because they make nitinol for their carburetor, for the NAT, jets. And nitinol is the one which we use for making what we call TAVI. That is the
trans-aortic valve
replacement.
Yes.
The Medtronic makes TAVI. It costs 22.5 lakhs. You need a proctor to come to help you. All those things are there. Now, Merrill near Baroda makes same thing. That is at 13.5 lakhs. Now, whatever it is, Indian buffalo, that is the bovine jugular vein, that is the one which is used. The biggest bovine jugular vein, what we get is 18 or 19 millimeter. If you have got an aortic root which is 23 or 25, if you go and put 18, you are creating stenosis. One. And the second thing is, bovine jugular vein is not going to last long-term results. Still nobody knows because it's only 2-3 years. But we have shown that we can do the same thing with the cooperation from NAL, and we have signed a contract also. And in fact, they made a stent for us from nitinol. So I was really interested in knowing how much it would cost for a stent. The cost? 8,000 rupees.
That's it?
Yes. And in Hyderabad, Al Kabir, Alanson, there are 2 slaughterhouses. Each slaughter 600 buffaloes a day. Will anybody consume the bovine jugular vein? It is thrown away.
Yeah.
So we are taking that and we are using these girls to stitch the wall.
Okay.
Even if you take 100% profit, still it will never come more than 10,000 rupees.
Huge potential for
yeah,
this.
but our government only says that make it affordable. What have they done? Let them encourage. They don't do that also. I'm very, very, very critical about it because I want to be honest as far as this is. Whether government officials hear all these things doesn't matter. They can't do anything to me. So there are so many things which we could do apart from making kidney or liver, heart, lungs, etc., etc.
So nearly 100 heart transplants, retransplants, heart-lung transplants down. Which has been the most challenging or most difficult case that you have encountered amongst them?
I think all the cases are same. There is nothing known as difficult. If it is difficult, it has to be complex congenital heart disease. The youngest kid we have operated is 11 hours old.
Okay. And what weight was that? What weight was that of the kid?
I think it was 1.8 kilos or something. We had to do it. They were willing for taking the risk. It came on Doordarshan. This is about 15 years ago.
Mm-hmm. You've been a pioneer in pediatric cardiac surgery, and everybody looks up to you for this. And I must share with my audience that Dr. Cherian has received the Work Hard Medical Excellence Award through a panel organized by Harvard Medical School. He is the first Indian to have also become the president of the World Congress of Thoracic Cardiac Surgeons and the first member of the American Association of Thoracic Surgery from India. He has also been the founding vice president and director of Madras Medical Mission and, of course, the founding chairman of Pondicherry Institute of Medical Sciences. Dr. Cherian, today you have shared with us a testimonial in the form of a preface of Dr. Albert Starr, and it's a preface to one of your books. May we have that, please? And also, Dr. Contam, the preface, may we have that on the screen, please? Dr. Cherian, you have earned laurels and admirers across the world. Dr. Albert Starr, an American cardiovascular surgeon with whom you had worked and trained in Oregon University, has written an appreciative note in the preface of one of your books. Dr. Albert Starr himself is the inventor of the Starr heart valve, which was world's first most durable mitral heart valve. And he says that amongst the leaders in India, you have a special place. He further adds that you are hardworking, innovative, dexterous with a sharp mind. And finally he states and laps it up with a compliment, saying that you have proven to be the best. And here's another appreciative note from Professor Francis Fontaine, best known for Fontaine procedure, from France. And he has penned down his thoughts in a foreword in yet another of your book. And he says that he has developed over the years deep personal and professional connect with Dr. Cherian. And here are a few words that Dr. Suresh Rao, himself head of pediatric cardiac surgery at Kokilaben Dhirubhai Ambani Hospital, has to say in appreciation and introduction of Dr. K.M. Cherian at the 5th Congress of Asia Pacific Pediatric Cardiac Society. And here is the excerpt of the interview at the plenary session that Dr. Tom Carl from University of Queensland, Brisbane took of Dr. Cherian. Here's a video where we can see Dr. Cherian with Honorable late Chief Minister Dr. J. Jayalalita at the inauguration ceremony of the building. Let me share with you all that Dr. Cherian is a 3 times doctorate in science and from 3 distinct universities, Dr. MGR University in Chennai, Tamil Nadu, from King George Medical University and from Pondicherry University. A fate which has been conferred onto him, which is seldom to be seen as a parlance. Dr. Cherian, back to you.
Yes.
How do you feel, sir, when this doctorate in science DSc was conferred upon you?
Oh,
What was the event behind it?
I don't think there is any event. I didn't know. I mean, still I do not know what is the meaning of DSc.
It's a doctorate in science per se. You do a PhD, and if you pursue, if you compile enough research work, then doctorate in science is conferred in the field of sciences, and a doctorate in literature, DLit, is conferred at the other end. And when people like you do so many firsts, you research, you wouldn't agree that you innovate, but yes, I mean, in the eyes of people, certainly you work, you research, you innovate, you do the first, and that's how it must have been conferred upon you. So humble of you to say so.
Well, I told you that I've been in the right place, right time, and I have plenty of God's blessings.
That is nice of you, sir, to say this. So, you've been a path breaker. You've been a change maker. Where do you envision yourself here on?
Here on, I got certain ideas, that, things are moving so fast, a microchip will be worthless. What you are going to have will be in your contact lens. If you blink twice, it will start. So, the student who is writing the final examination, he will have to only blink twice. He need not read the book at all because the book is in front of him. Science is rapidly progressing. Now, last year only, the emotions can be transferred. What is your emotion, what you are thinking, I will know it, and I don't have to talk, you will also know.
You mentioned that the world feels that when it comes to a robo or when it comes to a robotic surgery, it's the robo who's doing this surgery, say on a Da Vinci. But beyond artificial intelligence, as they say, that humans, that there is IQ, there is spiritual quotient SQ, there is emotional quotient, but what eventually lies with the human being, and what eventually you and I have to develop as humans is and will be learning quotient. It will be all about learning, evolving, and that's exactly what you are mentioning.
Yeah, that is what is going to happen, because this artificial intelligence, what you have got, will have to be controlled by artificial intelligence 2A. So otherwise we always... And just imagine what will happen to the dead body with the chip in your brain.
We have 2 questions here. May I ask you one, sir? There is Dr. Mohan Lal, and he says, in your long innings, what are the good qualities of a good student which are a must? And how would you rate someone to be a good cardiologist?
The first question, I don't think I'm fit to answer that question because I've never been a good student. Number one. And the number two, I can't say anything about cardiologists, but I can talk about surgery.
Surgeons.
Yes. Now, it is all developed by the surgeon himself because you should realize that you have, every one of us have got inherent talents, except that we don't recognize and we don't give any importance for developing it. See, in my case, I knew I have a good hand. The reason, even when I was 5-year-old, 6-year-old boy, I used to make pots and pans with clay. And later on, I little progress further. By the time I was in the third standard at that time, that means 5 plus 3, yes, 8 standard, or even little earlier. I used to repair, my hobby was repairing timepieces. We did not have this battery, timepiece or clock or anything. I used to enjoy that. So much so, my neighbors used to come and give me the clocks to repair.
And what about repairing some gramophones or radios? Did that also come by?
Not radio, but gramophones, yes.
Gramophones?
Yes. So that was the time, there was a necessity, and I had the interest, and I realized that I can use the hands. Now, if I tell you that, or none of the people will believe, even before passing my MS, first year MS student, I was very young. I was 23 years old. Nobody will believe that if I say, thanks to Professor Ullal, he is no more. I did my first heart operation, a PDA closure, at the age of 23.
That's really young.
And by the time when I went to appear for my MS general surgery, I had already done a dozen closed mitral valvotomy, which none of the examiners had seen.
You were in Kasturba Medical College in Mangalore for your MBBS and your MS.
Yes.
And then you went to Australia.
Yeah.
Sydney.
No. I went to Vellore for a year as a lecturer.
CMC Vellore and then to. Yeah. The other question, I'll just read that aloud for you. This is by Dr. Das, and he says that your message about nanotechnology for cardiomyoplasty in treating cardiomyopathy cases who are refractory to optimum medical therapies, including ARNI. What is your message? My
message is that, it is not nanotechnology. As far as I know, it is cardiomyoplasty using latissimus dorsi to wrap around the heart. But it needs a pacemaker for the latissimus dorsi to contract. But unfortunately, the pacemaker doesn't last long because the energy what is necessary is very high. So the latissimus dorsi plasty became a failure. But there have been so many other supplements. That is how all these stem cells or Batista operation, so many things came. Now you have got cardiac reduction therapy using what you call Manikanda technique. So there are so many things, so many people are trying.
So as we draw towards the close of this program, I still have a few questions to ask you. And my question would be, you said in the beginning that you are content with life, but I still ask you, do you have any desire unfulfilled?
Do I have any desire?
Desire unfulfilled.
Desire unfulfilled, because I have never expected something great for me because of my background. Only when you see, luxury and you don't work at all because you expect your parents to give you. My parents could give me only education, nothing more. And that too till MBBS. After that, nobody has spent any money on me. So the same way, if I had any other expectations, say a big house, swimming pool, Maserati car, or, going on cruise, accompanied by beautiful girls, I don't have any of those desire at least now.
And that's nice to hear that you are a content, fulfilled man who has started from humble beginnings and has reached pinnacles through sheer education which was gifted to you by your parents, and then after your dexterous nimble hands and moving on to your desire to give to the society.
Yes.
So with this, Dr. Cherian, we come to the close of this program. It is Legends of Medicine. You are a celebrated surgeon. And today, in this show, we are fortunate that we could actually celebrate your august presence amongst the medical fraternity who is the audience. To me, I believe it was very rightfully said, hand of God. You may say that you played with clay and that you played with timepieces, but you are truly a hand of God for many. And such is your legacy. And I bless all those kids who have been blessed by your presence in their lives. Thank you so much for being on the show. Would you like to say something?
Yes. It was a pleasure, talking to all the people who have been watching this program, number one. And number two, I'm grateful to you people for conducting this, and especially to you for being a good interviewer, in spite of the fact that you are a good IVF specialist also.
Thank you so much for your kind words.
Yeah.
Thank you so much.
Thank you for the time. Thank you for the good questions. Okay.
A legend always speaks things which are legendary. And as I shall walk down my memory path, for people, your name may be inscribed in that stone in the island of Kos in Greece, the birthplace of Hippocrates. But for me personally, your memory shall stay etched in my mind. Thank you so much, everybody. With this, we end the show. Stay safe, be happy, save your heart, love your heart, and be heart kind. Thank you so much.